Safety levels is just a review and a few little things that we've cleaned up in our process, and clarification of level blue handoff, and then how things are going to change a little bit when we go up to 3 North. So you should have 2 handouts. You have the PowerPoint that's up here, and then the process one, and that has some of the handouts that that are micro small in your presentation. So why are we going over this again? Well, we have some inconsistencies in the way we've been all implementing our safety levels, so we wanted to kind of get everybody back on the same page. And we've noticed that when looking at our patient falls, there's a relationship between families and us allowing them and giving them perhaps a little bit more responsibility for the patient safety than we should at their time from admission to discharge. And we haven't been really clear on caregiver training, so we wanted to clear that up as well. And then also how things might be a little bit different when we move to 3 North, which, by the way, we're moving pretty soon. Yeah. Okay, so quickly let's just go over our safety levels first. And so this is the same chart that we have that's posted by where the charge nurse sits on the counter. So if you have questions, or a lot of times you're like, I'm not sure if someone's a pink or a blue. It's there, and the area that I always look at to help me kind of decipher if someone should be a pink or a blue is looking at the patient indicator section. This pretty much tells me what the patient should look like. So if I have a patient who has memory issues, impaired attention, impulsive, right, they're going to be pink. Most of our patients that we have, based on their assessment, will fall in this pink section, right? But we will get some blues, and we will get some whites, okay? So some people think, well, everybody who's a fall risk is a pink. Not necessarily, but based on your assessment, and this is, think of it as separated out, fall risk over here, and think of cognitive, and that would be your safety levels, okay? So if you could have a high quad patient who is alert oriented, can direct their care, has good safety judgment, but because of their Schmidt score, and I'm just going to go back up here, right, will create probably a very similar plan of care because of their mobility, right, their elimination, they're going to need assistance. They may have fallen in the past. A lot of times the medications that they're on will put them at a 3. So then at that point, you're doing the bed alarms. They may require some type of postural restraint as well. So those are the things. So I think that gets confusing for people, is the yellow wristband piece and then the safety levels piece. So think more cognitive for the safety levels. And just another thing is, for our first 24 hours for our patients, we've all agreed, yes, they're all going to be using the bed alarm. We're also going to have a seatbelt alarm on that patient as well. Okay, we've been really good about bed safety, for the initial 24. And we tend to be a little bit more lenient once they're getting out of bed. So we're tightening that up too, and that should help some of our patient falls. All right, so this is our process. This is from admission to discharge, and so a patient comes in, and nursing's the first one to see them. So what we're going to identify them in their safety level, right? And when we do that, what we're going to do is we're going to identify, okay, patient is pink. And you can delegate off to Nate, hey, can you go get a pink wristband and get it on the patient, and that's fine. Our role is we're going to give out this handout, which is in the admission packet, and you have it in your packet here, and it's on safety levels. So we wanted to clean up and make it more easy and make it more consistent that we're all hitting the right pieces on safety levels. So what we've decided is we talk about the goal of the safety levels. Really, it's for safety of the patient and ourselves and the family. And then when you're wearing the pink, what does that mean, right? It means that the patient, they're unpredictable, forgetful, poor safety judgment, unaware of their deficits. And how's that different from blue, right? Maybe they're at risk of running away, they get more agitated, a little bit more aggressive. And then we just kind of put some interventions, kind of the key pieces of what they can and cannot do. Pretty much we're doing the assisting of the care for right now. And then if you have set a plan of care, like this person's going to be, for the most, has a posy bed, we're using the seatbelt alarm, so just go ahead and circle those, and then you can give this to the patient, okay? So this will be in the admission packets. All right, so going back to our process. So let's say we were admitting patient 131, right? And we pretty much knew in the beginning he was a level blue. So our new process, you would go over, put the wristband on, go over kind of generally the safety levels and what level blue is, and give her the handout, the family member. So now what we need to do is identify or let neuropsych know. And this is kind of a new piece, is we're trying to get neuropsych in early, okay? Because actually, the earlier we get neuropsych involved, I think it creates less work for us in the long run, okay, for nursing. And so they're going to actually, so we let them know who's a level blue, and what they do then is they're going to do more extensive training. They're going to arrange to do more extensive training with the family members, okay, on why we're doing what we're doing, why nursing is doing more of the assistance and supervising, because maybe they didn't need that prior to being here. So they'll be doing that. In addition to that, they're going to identify who the trained caregiver will be, because a part of our blue level handoff is we can hand off to staff, or we can hand off to a trained family member. So we're clarifying for everybody what trained means, and being really clear on who that is and what training they've received. So they can be up to 2. And once we've identified who they are, the neuropsych lets the rest of the team know, like through morning meeting. So it's key for us to let the charge nurses know, or you can email neuropsych, so you can email Lindsay Frazier, Christina Burrows, or Dr. Schrock, and let them know, hey, Mr. So-and-so, we've designated him as level blue. That's all you need to do. Then what they're going to do is they're going to get on it with the family, find the caregivers, and once we have identified who the caregiver is, then they talk about in the morning meeting or at ITM, and then we can start training, okay, and we'll go over that piece as well. So the key piece is getting neuropsych in early, so let the charge nurse know, so that they can pass that on and we can talk about it in the morning meeting. Okay, so neuropsych is going to initiate the education. Like I said, they're going to do more training. What they do is they now initiate this form. And this is like a competency form for the family. And this is hard copy. We don't have access to this form for good reason, because we're not going to initiate this. We can't do anything until neuropsych starts. So that's why we want them on board early. After they do the education, they're going to document who the family caregiver is going to be. And then we'll be able to start signing them off. So we can as nurses, or the primary therapist. So if a family member says, oh, can I go take my family member when we're up at 3 North, it's really only going to be to that family lounge area. And we'll say, well, wait a minute. In addition to being trained, they're going to get a blue wristband. So if we don't see that blue wristband on the family member, we need to go look into the hard chart. This will be in the plan of care section of the hard chart. So if I only see this part filled out, then I know that I can sign the patient off on these pieces. If I don't see this form at all, we're not going to allow them to do anything. We're just going to say, right now, part of our process is that neuropsych begins the education. That hasn't happened yet, but let me initiate that process for you. So at a later time, you can get your proper education and training. And it's safety, right? It's all about safety for you and for the patient and the staff member. So if you find in the chart that this part is filled out, you can go and basically it's on wheelchair basics, proper use of the helmet, right, to keep it on, because sometimes the patients like to take it off, that they're not going to take off the restraints or unzip the posy bed, and staying with the patient, because that happens too, right? They go out and leave the room for one reason or another, and then the patient's been left unattended, and to return back to the room if the patient's starting to become agitated. So these are things that we would talk about, or that they can demonstrate, and like I said, it's kind of like a competency for the patient's family member. So if this is all filled out, then we can give them the blue bracelet, the family member. Right now we're going to be using the blue wristbands that we use on the patients, so keep it kind of loose. Our goal we're trying to get blue bands that are the same style as the care partner ones for the family members. All right, so far so good? You got it?
Yeah.
Okay. So the next piece I wanted to go over with you it's the second page of the process packet, and it's just some quick clarifiers. So when we talk about the handoff piece, so there's 2 components of handoff. There's the verbal part and the physical handoff. And so say I'm therapy and I'm handing off to Elizabeth, and so say the patient is in a posy bed, so I can, if you want to go back to bed, I can put him in the posy bed and zip it up and leave him there, but I still have to verbally hand off to you and say, oh, by the way, I've left Mr. So-and-so, right? or if the trained family member is in there, I physically hand it off to that trained family member with the blue wristband. I still have to talk to Elizabeth and verbally hand off. So we just wanted to be clear on that. Or the sitter, same thing. Can the family member be involved? Well, we've already talked about that. They have to be trained, and we've clarified that process with the competency checklist. They wear the blue wristband. And then who can do the training? So it can be the nurse, the charge nurse, the neuropsychologist, or the therapist. And then where can the patients go? So right now, we have so many areas they can go to. They can go to the rec big TV area, and we've had questions about patio. But when we move up to 3 North, it kind of just geographically limits us. So that's good. We're thinking it's probably most likely going to be like in the hallway area and in that patient family lounge area. And again, we're sharing that with MICU, so that might be overstimulating, so it's going to be case by case on if the patient should go there or not. If they are coming off the unit, coming out, to other areas, then that they will need an order for that, and we won't likely be doing that with our level blues. So, some myth-busting pieces. So, posy bed does not automatically mean level blue, right? Because we can have patients who are level pink or impulsive who need the posy bed. If somebody's a level blue, it doesn't automatically mean they have a sitter. They can, but doesn't always. A level green always has a sitter. If somebody's in a posy bed or are using a bed alarm, then they need the equivalent while in the chair, right? So they need the pelvic posy and the wheelchair alarm, because it's looking like a lot of them are getting to be pretty fluent in untying posies, pelvic posies, so we need that extra alarm. Can a level blue be left alone? They can if they're zipped in the posy bed, not unzipped, or if the bed alarm is on, if that's the plan. And like with our patient in 131, if you look at his kind of 24-hour process, right? Like on night shift, he's been pretty good. So he could be a level pink if they just looked at it. On day shift, he's pink, but starts to turn a little bit into blue. And then on your shift, on PMs, right? That's when most of the activity was going on, and you're definitely level blue. Well, what we're trying not to do is pink, blue, keep changing the levels within the 24-hour period. So if somebody is a level blue, we're not going to change them to go into a level pink until all 3 shifts agree that he can be a level pink. All right, because it gets too confusing in terms of the plan of care for the patient and for the staff and for the family. And then one discipline, so if OT says, I think he can be a level pink, they can't make that ultimate decision. They need to talk to nursing as well, because we can say, well, on night shift or on PMs, he's still really, aggressive or agitated, so we're going to leave him as a level blue. So we're just trying to clarify for the whole team. So a lot of this decision making and discussion is going to happen at ITMs and the 3-hour rule meeting. So we're trying to, in the morning, so we're trying to get, all of us to communicate to the charge so that information can get passed on in the morning, and neuropsych can get more involved. So our basic process is really no different. So on the SPM tool, we're still checking off the safety level. The wristbands, nursing is responsible. We can delegate that task off to an aide, but we are responsible for the education. We're responsible for the communication order of writing what level is, because that's the only way that all the disciplines can see what safety level the patient is, and just put it as a department process. And then we're revamping the process of the labels on the wheelchairs for our level pinks and our level blues, so that all the patients or all the families and staff are aware, if they see someone going down the hallway, that we need to address that. So we're going to take it on as a part of our responsibility for nursing, but we're going to see how that goes. So we haven't fully committed to saying that we're going to do that forever. Again, communication is probably the biggest part of this process. So notifying the charge nurse of any changes, or someone needs to continue to be a level blue. And then the charge to charge will, that communication will go on, and then it gets talked about in the morning meeting. And then neuropsych is taking a bigger responsibility now in letting the rest of the team know. So they're going to do that. Okay. All right. So based on what we've kind of talked about real quickly, we've got 2 case scenarios to go over real quickly. So your patient is a level blue handoff, and you're wheeling him back to his room after therapy. You see the patient's wife. She's sitting there, and she says, "Oh, you can leave him here with me. I will watch him." So what would you do now?
Ask her if she's been trained and see if she's wearing a bracelet.
Exactly. Very good. And so if she's wearing the bracelet, you can
hand off to her.
Right, but you would also verbally hand off to the nurse.
Oh, yes.
Right, great, very good.
I'm assuming I'm the nurse.
Now, if she didn't have a wristband, what would we do?
Tell her she needs to have training before you can leave her alone.
Right, so we would not leave. We would probably make a U-turn, right? And
Yeah.
take her, very good. Yes, so, if she, like what Elizabeth said, if she's okay, I mean, she's got the wristband on, then that's fine, but we still need to do the verbal handoff to the nurse. And if she didn't, Elizabeth, you said it very nicely too. You can script it in your own way. I'm sorry, but because you haven't been trained, we'll supervise the patient. Safety is important to us, and we'll initiate that process for you and let neuropsychology know. All right, last one. So you are admitting a patient who you have assessed to be a safety level blue. His wife is sitting at the bedside. You place the blue wristband on the patient. What do you do next?
Educate the family member.
Right, and you're going to use
the computer and use our sheet that will be in the packet.
Perfect. Yep. So you're going to use the handout, document your education and Cerner, of course, and then you'll notify the charge nurse and get neuropsych involved early. Well, very good. Any questions? Pretty simple, cut and dry. We tried to